Josie and everyone watching today.
Hello.
This is Are You in Session? All right, so welcome.
Welcome back. Let's get started. We're changing it up today,
Yeah.
not being on a Friday.
It's a Thursday, and it's going to be a shorter one. Sorry, guys. I know you're going to miss talking to us for an extra 15 minutes.
We're wrapping things up just like we're wrapping up the year 2023.
Yes, and treatment.
We didn't even plan that.
No, we didn't.
Yeah, that's right. So today we're going to be talking about what it looks like, or I guess some reasons why clients may end treatment.
Yes.
So
yeah, there's a lot of different ways.
Yeah. Who knew that there were so many ways to end treatment?
Who knew that therapy could kind of end?
Does therapy end?
That's the question.
Let's figure it out.
Okay.
Okay. So you and I put our heads together and we've talked about some ways that clients cease to continue therapy or reasons they might stop coming to therapy.
Yeah, whether it's a break, whether it's forever, whatever.
Mm-hmm. So what's your most favorite way that a client ends therapy, or a reason they end therapy?
They've met their goals and they feel good. Like they're in their life where they're like, I'm at this place where I don't know what to talk about anymore. Like I'm coming to therapy and I feel like I have nothing to talk about. It's almost annoying to go to therapy at this point because my life is good.
Right. So that's probably the most ideal way ideal reason someone would end therapy is they feel very accomplished in their goal meeting. Obviously the therapist agrees with it and says, hey, right now you have nothing new to work on. See you down the road.
Yeah, and it's nice for us when they actually come in and they say, hey, either I think maybe the next session can be my last or today, because then it's like clean cut of like, okay, we know this will be the end, and then we talk about it and we can talk, and then like it gives us, the therapist, an opportunity to ask them questions about the experience and just sort of get some feedback of like, how was this process for you? And then also like that's a time when I like to take the time to really affirm them and be like, you did it.
Yeah,
I get
you
to
did the
cheer them
work.
on, even a little extra.
To me, that sounds a lot like closure for both the client and the therapist of, hey, you met your goals. We agree with that. What are you going to do to maintain this? And also, how can I encourage you in that? And then some safety planning of if you need to come back, let me know, or here are other places you can go to if you need it.
Yeah, it's an opportunity for us to make sure everything is like kind of tied nicely in a bow as well as it can be given life.
A little Christmas bow.
Yes, exactly.
Birthday bow.
Like, here are all the things I want to tell you. And then there's the people that maybe it doesn't end that way. And I'm like, I wish I could have told them this.
Yeah. So it's the well, at least what you're talking about is like the therapeutic version of ghosting.
Yes.
Which is similar to the dating version of ghosting, where it's just like, poof, disappeared. Gone.
Yeah.
What do you do when a client ghosts you? Do you pursue them? Do you reach out? What does that look like for you?
I usually do try to at least once, just to make sure, like, give them an opportunity and sort of a reminder of like, hey, I am checking in. Sometimes people just put it off and forget, and they're like, okay, well, here's my in,
right,
or way to come back in. Yeah. What about you?
I think I typically try to reach out at least once, whether, to be honest, sometimes I ask Hannah to call and just ask if they need to get something scheduled. I feel like a lot of times I'll reach out or I'll ask Hannah to call or I will call and they still don't answer. And so I wait a couple of weeks and I close their file and I wish them well and I hope they're doing well, and I may not ever know why they stopped.
Yeah.
And what would you say are some of the reasons clients might, ghost therapy?
I feel like there's a few. Ones that come to mind for me would be either kind of like what I was saying earlier, like they are in a good place and it gets to a point where they're like, man, therapy is almost just like more annoying to go to. And that's not even a bad thing. It could just be like, I'm in a good place. I got nothing to talk about, and I would have rather used that hour for lunch or something. And so instead of actually saying like, hey, this is my last session, they're just like, I don't need it, and it kind of falls off, or they thought they did and they didn't.
So all of the communication we hope that they have, they don't apply in this therapeutic relationship.
True. I mean, I guess like silence is still communication, but it would have been nice to know what happened there.
Right. Right.
And then like the others that come to mind could be like they are avoiding something, or maybe something else in their life came up. They have a new crisis and it just feels like it's too much. Also money. If they are having a hard time affording therapy.
And that's hard to talk about too. Like sometimes I can't afford, so I'm just not going to talk about it at all.
Yeah, I'm just going to avoid you and hope that I'll pay my bill off later. I don't know. Are there any that come to mind for you?
I think sometimes if a person feels pushed really hard and they're not ready for it,
too much too soon,
they might be like, oh, or the other thing is you might not be a good fit for, like the therapist may not be a good fit. And if you're still learning how to be assertive and communicative about that, that might feel uncomfortable to say, hey, I don't really vibe with you. And so I need a new therapist. And so they just stop.
Yeah. Yeah.
So there'd be that. I think,
which as a therapist, it would be helpful to know if someone ever felt uncomfortable with me, whether it was just like we just weren't a good fit, or whether it was something I did that was offensive. Maybe I don't know. I would like to know those things.
Right. I think overall, and this is a little bit of a rabbit hole, but I think when it comes to ending therapy, the best and worst part of it for the therapist is we no longer know what's happening in your life.
Yeah.
And so, you know, just like a client becomes accustomed to coming to therapy and talking about things regularly, we become accustomed to getting a glimpse into your life. You know, we get a very personal window to look through. And so I think it's always fascinating when they're gone, when occasionally it's like, I wonder how they're doing.
Yeah.
Or I hope they're well, or even the scary one of like, I have no clue. And maybe I didn't think they were ready to end treatment. And so, gosh, I really do hope they're well.
Yeah.
And kind of just, you know, thinking about them in a very professional way.
But yeah, maybe we're not robots. Like they don't just come and go and then that's it. Like they are people. They are humans with lives, and
we're people.
We are in there in the most intimate part of that life. So,
and we care about our clients,
of course,
even the ones that end treatment successfully. Yeah, there's times that, you know, whether I'm cleaning up my case files or what, and I'm like, man, I hope they're doing good.
Yeah,
I have no way of knowing, but I hope they're well.
And that kind of makes me think about breaks in therapy. Sometimes, like, what would be a time that you would sort of recommend to a client that they take a break?
Okay. Well, gosh, I would say that depends. So it depends on if they're seeing me individually or relationally. I think, you know, if I'm seeing a couple, I might say, hey, we need to take a break from couples counseling and you guys both need to go pursue individual therapy.
Yeah, you got to do some internal work so that we can, because you can really get to a block where it's like, we're not getting anywhere because you guys have some your own stuff,
some work to do.
Yeah.
And then also vice versa. I might be seeing someone individually and say, hey, I think you've done all that internal work. Now we're getting into relational territory.
Yeah, you're just talking
your
about
partner
husband.
needs to be here. Yeah. So that might be a time where we pause that individual treatment and they move to relational treatment with a different therapist. I prefer to stay in the same lane. So if I work with someone individually, I will probably only ever work with them individually. If I work with someone relationally, I will probably only ever work with them in relational therapy. And so
most of the time,
there's some exceptions. So yeah, that might be a pause or a break, and that doesn't mean it's over and done forever. But maybe in the meantime, I think there's also, depending on what they're coming to me for therapy, if they need a different type of specialty or if they need a more intensive type of therapy where they're seeing someone more regularly or even inpatient.
Yeah. Sometimes too, it's like when I'm thinking of a break, so we've talked about this before, like therapy
just like Ross Geller, like we were on a break.
Yeah.
Okay, sorry.
Sometimes like a break can be like you're ending therapy and you can come back whenever you feel like you're in another crisis or the problems are coming back or whatever it is. But also sometimes I'm like, let's feel out once a month. Just so you can kind of put your toes in the water. You know you have this appointment set up. You can cancel it 24 hours in advance, of course. And so I'm like, there's that type of break where it's like less frequent. But then
spread out.
Yeah, but then also it could just be like, you know, we haven't been in the field very long time.
We're still pretty green.
Yeah, so we haven't probably had like a ton of therapists or clients leave and come back, but when it does happen, it's kind of nice because it's like, okay, like tell me about life in between, and like you can really see the progress of like, yeah, you still are making progress and doing the things you learned, but now you just have a new bump in the road.
I think, yeah, there's a few that I've had, again, not many, but a few that they disappear, or it's, hey, I'll call back and schedule, and then they never do, and then 6 months later
Like,
they
they're
show up
back
on my calendar, and I'm
yeah.
like, oh, okay.
What happened?
And it is so fun to see because a lot can happen in 6 months for a person. So whether it's, oh, nothing has changed, or some things have changed and we've got some work to do, those are always fun to see because, again, it's that it satisfies my curiosity of what's happening when you're not here.
Yeah. So the question is, unless I'm missing something because you're the one with the notes today,
The note keeper.
does therapy really end?
You know, I want to say no, honestly.
What do you mean by that?
But I think what I'm speaking to is like the growth and the progress that you make in therapy should not end.
The work you're doing outside of the room.
Right. Now, I may not be going to therapy, which to me, like going to therapy is me taking my happy tail to my therapist office and sitting on a couch or sitting in a chair and getting vulnerable and getting transparent and being reflective and doing the work. But I think there's some of that still needs to take place, whether I'm seeing my therapist every week or every month, or I haven't seen them in a year.
Yeah.
So I want to say no, therapy doesn't end. I don't know. Maybe it does, though.
I mean, it's like going to the doctor, right? Like go to the doctor once a year when I'm healthy. If I start having pain in my back and I don't know what it is, I might be going more often.
Right.
And then 5 years later, maybe I'm pregnant and I'm going to the doctor more often, you know? And like, well, you're probably going to the doctor until you die.
Right.
And I think we forget sometimes that therapy can be like that. Like, I have problems in my life. I work on them. I manage them well without a therapist. And then it gets hard again. I go back to my therapist.
Need some supports.
Right? Like, that's how I see it.
Controversial, but I go to a chiropractor. I don't know if you knew that was controversial.
And yes.
I did not know that until someone told me.
Yes, it is.
But what I like about my chiropractor is that he gives me exercises to do outside of that appointment.
Not every chiropractor does.
Not every chiropractor does. That's why mine's superior.
There's a little shout out.
Exactly. I'm going to make him pay us before I say his name. Also, it's hard enough for me to get in there, so I don't want everyone filling up his schedule.
Sorry.
But the thing is, he has me do work outside of that appointment, and I feel like therapy is the same way. And that's why, to me, it's like, okay, I don't go to the chiropractor every single day, but I do try to do the exercises more regularly. And I know that's something we've talked about in our previous videos of therapy doesn't take place just in this 1 hour and once a week in this room.
Yeah.
You have to do the work outside of therapy. So I think for me, that's really what it seals the deal if therapy does not end.
Yeah. And, you know, even I maybe I've mentioned this in one of our shows before, like, the first time I ended my own therapy, my own personal therapy, of course, like, I felt good. We had our last session, and then the next week was horrible. It was horrible. And I was like, why did I end therapy? What was I thinking? And then I stopped myself and I was like, Mary, you know what to do. Just because something hard is happening doesn't mean you don't know how to handle it. Like, you are capable. You have the skills you've learned. And it, like, helped me to just be like, wait, yeah, like, it did its job. And then I did go back like a year or so later, but it was nice to just remember, like, I'm capable of doing it just because but you get comfortable with that, like, appointment set of like, okay, I know I can talk about this with this person, but in the end, like, we are the ones doing the work. And the actual session itself is not the fixer. The therapist themselves is not the fixer.
You are. You're half the time I tell people, like, you're the problem and the solution.
Yeah.
So go
I like
do.
that. You are the problem and the solution. Yeah.
So is that
I think we're about out of
the
time,
main
but
reasons why people end treatment?
I don't know. What do you think? What if we could do a poll? Is it usually they really do feel like they've made progress? Is it that they're avoiding something?
That's a great
Is
question.
it that something else?
I don't know. Some people never want to end treatment, so I don't want to give people.
Yeah, and that's fine. I mean, I'm always telling my clients, like, look, I'm trying to work myself out of a
That's
job.
right.
I want to make sure you're actually feeling like you're getting what you need. If you do want to keep coming, like, and you want to pay, by all means.
Right.
But I want you to feel like it's not a waste of time.
Right. Yeah, I would agree. I think I don't want people to stay in therapy forever, but I want for them to know that it's an open door. They can always come back.
It's fluid. You can, like, same with couples and individual therapy. It's not just a checklist and you call it good for the rest of your life. Like, same with couples. They can have their couples therapist and come in and come out. And
Yeah.
yeah.
And that therapist can be different too. Can be a different person, I mean.
Mm-hmm.
So. Well, since we are discussing ending treatment, let's end this video.
Yeah. So what is something you usually say to a client in their last session?
I always try to encourage them, and I ask them to reflect on what they felt like life was like when they first started therapy and how much progress they have made and where they recognize that they're at now. So it's kind of the whole like mountain climbing. Like you have to look down at the mountain to realize that you did climb a big one and to celebrate that and be proud of themselves.
Yeah, I like it.
What do you say to them?
I usually tell them the story, like I just said, about how I personally realized, like, wait, no, I'm capable. And I kind of remind them of that, like, hey, you have the skills, you know what to do, but if you feel like it is still overwhelming, you know where I am.
Yeah, I love that.
Yeah. All right. Well, thanks for sitting with me today and for all those listening or viewing us.
Make sure you join us in the next year. Mary and I are going to put our heads together and come up with new content for 2024.
Yeah,
But
feel
in the
free to give us ideas. If
yes,
you're like, I would really love a therapist to talk about this.
Please do. Or if there's like guests or I don't know, anything you want for us to talk
TBD.
about, we might bring some people in.
Maybe Hannah, our producer, will join us
Oh,
sometimes.
yes.
With her cute headphones.
That's right. Also, in the meantime, be sure to check out our other videos like Josh and Carrie. We also have a podcast. Therapist Take. So you can find all of that information on our website or on our Facebook. So like, subscribe, do all the things.
Yeah.